You know, in healthcare, whether we're talking about a simple checkup or a major surgery, there's one thing that is absolutely fundamental: your consent. It's the very bedrock of the relationship between a doctor and a patient. But here's something many people don't realize. Consent isn't just one single thing. There are actually three distinct types, and understanding them is really the key to being an empowered patient.
So let's start with the most common kind of consent, one you've probably given many times without even saying a word. It happens all day, every day in clinics and hospitals. It's called implied consent. It's kind of the silent agreement that keeps all of the routine healthcare moving along.
Just like the name suggests, implied consent is all about a patient's actions. It's a pretty powerful form of nonverbal communication, right? It creates this mutual understanding based purely on the situation. The patient's own behavior is what signals that they're willing to go ahead. Just think about how simple this is. You sit down in the doctor's office, the nurse approaches with a blood pressure cuff, and you automatically roll up your sleeve. That's it. You've just implied your consent. You didn't need a long discussion or any forms. Your action was the permission.
But it's so important to know where the line is. Implied consent is only for routine, low-risk, non-invasive procedures. Think about a doctor listening to your chest with a stethoscope, or just a standard physical exam. We're talking about the everyday interactions of basic care.
So, what happens when a procedure is a little more involved? Well, that's when we move on from implied consent. We need something more direct. This is where we get to express consent, where that unspoken understanding just isn't enough anymore. Express consent is exactly what it sounds like. It's a direct, clear, and totally unambiguous agreement. You, the patient, give your permission out loud with a yes, or maybe by signing a simple form. There's really no room for interpretation here. The agreement is stated plainly. A perfect example of this is when you're at the dentist. The dentist tells you that you've got a cavity and you need a filling. After a quick explanation, they'll ask if you want to proceed. Your verbal yes in that moment, that's a form of express consent.
The key differences here really boil down to clarity and scope. Express consent is just unmistakable because it's either spoken or it's written down. It's typically used for minor procedures that might be a little bit invasive, like getting stitches or a filling, but they don't carry any significant risks.
And now we come to the highest and most comprehensive level of consent. This one is absolutely fundamental to modern medicine. It's called informed consent, and it's best to think of it not just as a transaction, but as a real conversation, a shared decision.
What's so crucial to understand is that informed consent is a process. It is not just a signature on a form. It's a dedicated dialogue where the doctor empowers you, the patient, to make a voluntary and, informed choice about your own health. It's all about respecting your autonomy. For consent to be truly informed, 4 things have to happen. The doctor must disclose all the relevant information. They have to assess that the patient has the capacity to even make the decision. They need to confirm the decision is voluntary, free from any pressure. And finally, they have to ensure the patient truly understands it all.
So, what information exactly has to be shared? As the patient, you have the right to know your diagnosis, the nature of the treatment being proposed, all the potential risks and the expected benefits, and, just as importantly, any reasonable alternatives. And that always includes the option of doing nothing at all.
And this isn't just some ethical guideline. It's a legal requirement. In fact, a landmark ruling by the Supreme Court of India cemented this very principle. It stated that for major procedures, consent is only valid if it's based on adequate information about both the nature of the procedure and all the risks that come with it. But how can a doctor be sure the patient really gets it all? One of the best tools for this is something called the teach-back method. This is where the doctor will ask the patient to explain the plan back to them, but in their own words. It's a simple but really powerful way to check for understanding and clear up any confusion. All right, so let's just bring it all together. You have implied consent for routine exams, given through your actions. Then there's express consent, that clear yes for minor procedures. And finally, informed consent. That's the comprehensive, documented dialogue that's required for any major or high-risk intervention. Basically, the level of consent always has to match the level of risk.
Understanding these 3 types of consent is so essential for every patient and every healthcare provider. It's what really transforms medical care from just a service into a true partnership, one that's built on respect, clear communication, and a truly informed choice. Your MedLawyer, protecting doctors, empowering patients.